the melodious sounds of a town hall meeting. Smells like August, doesn't it? Read the bill seems like a simple and legitimate request for something that could fundamentally change the life of every American. But when Senate Republicans tried to offer amendments asking for 72 hours to do just that, read the bill, before voting on health care legislation, those amendments were rejected. Senator Lamar Alexander is a Republican in Tennessee. He says that's not right. A Republican that now is taking up the call again yesterday in the Senate floor. And Senator, welcome back here. What a novel idea, huh? I think most Americans, especially in our audience, don't understand. Why would there be opposition? What would be the motivation to prevent a 72-hour period? Look, this health care thing will put you to sleep at night. I mean, it's huge. It's 1,000 pages. I don't know many people are going to read it in 3 days anyway. I think it's the principle of the matter. So go for it. What do you think?
Well, it's more than, well, first it's almost embarrassing, to talk about, to say that we would vote down in a Senate committee the idea that we put it on the internet for 72 hours. Of course we should read the bill, and of course we should know what it costs before we vote on it. And you asked the motivation, I'm not sure, but one might be because if you read the bill, you find some things out. Like Harry Reid, the Democratic Majority Leader, has put the fix in for Nevada so they don't have to pay for their Medicaid expansion. It comes from California, Florida, and Illinois citizens. Or you might find out that your insurance policy is going up instead of down. Or you might find out how much your Medicare benefits are cut if you're a senior. Or you might find out that the assumptions that say it's balanced and doesn't add to the debt are wrong, and that it actually does add to the debt. So we ought to read the bill, and we all know what it costs.
Did those town halls mean anything to lawmakers in Washington, or were those people just invisible?
Well, no, I think they meant a lot. And I think one of the reasons that you're going to see some people on the Democratic side trying to push this bill through fast is they don't want people to read the bill. And they know if they do read the bill that they'll say, look, we don't want a big comprehensive change of our health care system that cuts Medicare and adds to the debt. Let's take it step by step and fix and reduce costs. I mean, that's what we ought to be working on, and re-earn the trust of the American people by reducing costs step by step.
You know what Democrats are saying already, and just to take the other side on this, Senator, they're saying you're stalling, you're buying time. Let's say they're right. What do you gain from buying time?
Well, you find out if the Senate Majority Leader has put the fix in for Nevada in a way that's unfair to California. You find out if your Medicare benefit is really being cut, as we say it is and the President says it's not. You find out if your governor's right, that if you dump all these Medicaid programs on the state, that your state taxes are going up. And you find out whether it's true or not true that your Medicare Advantage program will go away or be cut, which is different than what the President said. So you need to read the bill to find out what's in it, and then we can vote on it.
You know what? I think this is a classic case of how differently Americans view their own government. And I think it's a very good example for how some Americans trust Washington and others say, forget about it, leave me alone, I can do this on my own. And you've mentioned now 3 times this exemption that Harry Reid has slipped into the bill. Now, I mean, how do you think that's going to fly?
I don't think it's going to fly very well. I mean, I believe that every senator is hearing from his or her governor, Democrats and Republicans, and say one thing: if you're going to expand Medicaid in my state, federal government ought to pay for it. Well, Harry Reid's saying we're going to pay for it in Nevada, but we're not going to pay for it in California or Tennessee or Illinois or the other states. And I don't think people are going to like that.
On the 72-hour deal, you think will you win on that score, yes or no?
Well, I surely hope so. I mean, I cannot imagine that there'd be 10 people
you're not
outside.
Quite sure, right?
Well, they voted it down in committee by 12 to 11. Every Democrat voted against it.
Well, the other thing is the public option failed in the Senate Finance Committee. It went down in 2 different votes to defeat. Meanwhile, on the House side, on the same day, Nancy Pelosi is saying we've got to have that in our bill. I'm thinking President Obama's got to weigh in on this soon and probably serve as the babysitter. How's that going to turn out?
Well, you also have the government option in the bill that came out of another Senate committee called the Health Bill. So what's really going to happen here is you're going to take whatever the House passes, and then you've got 2 Senate bills. You're going to put them all together. That'll take a week or 2, and then you're going to have to find out what do they actually cost. That'll take a couple of weeks. So that'll give the American people plenty of time to find out what's in the bill and how much it costs, unless they ram it through.
It tells me we're going to find more nuggets along the way. Lamar Alexander, thank you for your time, sir, from Washington today.
Thank you, Bill.
All right. Martha, what's coming?